Hi, Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. We always enjoy having Dr. Sophie and Sayfo here with us from Uncommon Orthodontics, and we love hearing from you what your concerns are about oral hygiene and tools that are used to correct deformities and things of that nature. Maybe you have questions about surgery or braces or things like that. What are your fears? We'd love to hear those. So if you'll just message us on Facebook, Magic Mix 92.9, let us know what you're thinking, and we'd love to talk about that next week. We'll even give you a little bit of a mention and pose your question to Dr. Sophie and Sayfo. So he's in the studio with us this morning, and we're going to do a little bit of myth busting. So onward with that. Doc, good morning. Welcome.
Good morning.
So I know a lot of people out there think they're afraid to go to the orthodontist because they hear so many horror stories and myths out there about the exorbitant costs or the painful experiences they have. And that's simply not always true, is it?
Yeah, let's we're going to address some myths today, but I would start by, please don't take your information from your classmate or close friend or sister, brother, or even from TikTok or YouTube. We are here just to answer those questions. So as you mentioned, if you can post those questions next time, I use those terms all the time. Next week, we will address those and answer those questions. But yeah, you're right. So many people come to me and ask about like the horror stories that they hear about like braces and the pain associated with them, which is really exaggerated. I tell my patients, braces should not cause you pain. They could cause a little bit of a soreness, discomfort for the first 23, 24 hours. It depends, because pain is subjective. Some people, perceive pain differently. The way we put braces is absolutely not drilling into your tooth. So that's the first thing. We do not to drill in your tooth. We do not need to numb you. It's literally, as I tell my patients, like a sticker. We literally put a glue behind the bracket and put it on your tooth. Of course, there's a lot of steps to do that. None of them is painful.
I know a lot of people talk about, well, I heard my friend, they went in after having braces on for 4 to 6 weeks and they tightened the braces. They took this thing and took the wires and really scrunched them down. And, that sounds really awful. It sounds like torture.
Yeah, absolutely. I hear these terms all the time, and I try to tell the patient it's not tightening. We are not tightening your braces. Basically, what you do is we place the braces on the tooth at the best position possible, depends on the case. And then after that, we put the smallest wire. Thin, small, soft wire. The next time that wire done doing its job, we advance to a little bit thicker, a little bit bigger wire. That's what you feel, and you think it's tightening. We don't tighten anything. The bracket is the same. We just open the door, put the wire through the bracket, close the door, move on. But the wire is a little bit thicker, so you feel a little bit of a more pressure, which is a good thing, because that means it's working.
The teeth are supposed to move, right? I mean, the purpose of braces is to move teeth so they are aligned better, which is better for your health and your look.
That's correct. Exactly. That's exactly what happens with the pressure. The teeth wants to escape that pressure and move in that direction to a better position that's designed through the treatment plan.
And Doc, one of the myths I've heard is that if I'm going to go get braces, I have to invest in all this really cool whiz-bang water pick technology and things like that. And is that true?
Now, it depends on your financial situation, but you definitely do not need to come up with a big lump sum of money. Our office, particularly, we offer a small down payment in the beginning. It depends on the month, but it's about $200 to $250 down payment, and then after that, it's going to be your monthly payment stretched as far as 2 years or more. So it's going to be kind of like more of accessible for most people.
A girl I knew a couple of years ago went and got braces, and she said because of the braces and she thought she had to change her diet. She lost like 60 pounds. And is there any truth in that at all?
No, as simple as this. When you put braces on, again, we glue them on the tooth. So we want to maintain them along the treatment. So we do not want them to break. The only thing that you have to avoid, technically, is any food that is hard, chewy, or crunchy. And I'm talking about like really hard, really chewy, really crunchy. Okay. Like nuts, hard candy, don't chew on them. A big, juicy apple, don't bite a big bite of this one. Cut it in small pieces. But you do not need to give away good, healthy nutrition, food. You just need to adapt around it so you do not break those brackets.
I think one of the hardest things about braces, and I got braces at 37 years old, believe it or not. And I think the hardest part of the whole procedure was my part in remembering and taking responsibility and remembering to wear my retainers every night.
Yes, after you're done with braces, and that's across the board, no matter how small, big, comprehensive, detailed, long, short your treatment, the second you move teeth around, you need to maintain them. Teeth want to relapse and go back to the original shape. So once you are done with the treatment, you have to wear your retainer. We start by wearing it full time, then we go to nighttime and we reduce it gradually, but you should keep wearing your retainer. And the simple answer is for the rest of your life.
Gotcha.
Just to keep your teeth where they are. Until the moment you do not want your teeth to be straight, then you can drop it and then the teeth will relapse.
Doc, that's all great information. And if somebody wants to come visit you at the office, even just for a free consult, where can they go?
Yes, we are located on 2330 South Range Line, and you can always find us on uncommonortho.com or on our Facebook page and Instagram page.
Again, Dr. Sofian Sayfo with Uncommon Orthodontics. Thanks for watching Wellness Wednesday. I'm Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. We look forward to answering your questions with Dr. Sofian Sayfo next week.